In today's Medical Minute, we're going to talk briefly on sore throat, specifically strep throat. I'm Eric Chapman, owner and medical director of Allegiance Health of Southwest Florida. Here in Naples, Florida, we're a hybrid medical practice that focuses on wellness, sick visits, and employee health. Today we're going to talk briefly on a really common disease that we see here in the clinic, which is strep throat. Let's get straight into it. Strep throat is just one of the many causes of sore throat, and depending on the time of year, you can get a lot of different kids that come in experiencing a sore throat. The majority of sore throats are viral, meaning they usually go away on their own with supportive therapy such as fluids, rest, and anti-inflammatories and antipyretics like Tylenol, ibuprofen, etc. But strep throat is a little different in that it's caused by a bacteria, and you want to try and treat this with antibiotics to try and prevent some of the after effects that can happen if untreated strep throat becomes an issue, such as rheumatic fever and things of that nature. But for the most part, you're dealing with someone who's complaining of a sore throat. Sometimes they'll look in the back of their throat, they'll see white patches on their tonsils. Their tonsils can be enlarged. A medical professional can look in the back of the throat and they can see what's called exudates, those white patches. Sometimes they'll look on the hard palate on the roof of the mouth and you'll see little red spots, or what's called palatal petechiae. And these are just all signals for someone like me to say, okay, well, this person maybe has strep throat. Again, because if you think someone has strep throat, you're going to want to probably treat that with antibiotics. There's some other things that you can use to decipher whether it's viral or bacteria. Most of the time you're going to do a throat culture and a throat swab, a strep test, but usually patients who have strep throat won't have a cough. And now that's not always the case, but the absence of a cough and the swelling of lymph nodes in the anterior cervical chain is really common. And sometimes patients will have a change in the sound of their voice or a laryngitis. Sometimes they'll have an associated kind of what's called scarlatina rash. And all of these things are dependent on whether you're going to see them, but these are some of the things that you can find in association with strep throat. Now, let's say you've made the diagnosis of strep throat, you want to treat a patient. If a patient doesn't have an allergy to penicillin, you're probably going to want to go down the penicillin route, but there's a few other medications that you can use if someone has a contraindication or an allergy to penicillin. Azithromycin is a common medication you can use as well. And there's some other things that you can do too. Remember that strep throat can cause swelling, pain, and sometimes depending on their ability to tolerate fluids and whether they're having a lot of discomfort, you can give a form of steroids. Sometimes we give what's called dexamethasone. So your goal is to decrease the inflammation, start an antibiotic, get the patient to hydrate well. Sometimes it's associated with a fever, so you want to maybe use medications for pain control / fever reduction like Tylenol, ibuprofen. And these are some of the things that medical professionals will do when you're dealing with strep throat. Thank you very much. Have a good day.